I've been told very strict instructions that I have to finish by 3:30, which is in 15 minutes. So I'm going to do my best to go as quickly as possible. But ultimately, in this panel, we're going to be talking about the future of healthy longevity and what that looks like. So I just wanted to start the panel off by asking each of the panel members, first of all, introducing themselves, because I'm aware I didn't introduce everyone properly, so apologies. But start the panel off by asking each panel member, what do you believe the future of healthy longevity looks like to you?
So my name is Nicolina. I'm one of the co-founders of GlycanAge. And I think healthy longevity primarily starts with more years of healthy life, disease-free, for which we need markers that can preempt specific problems, and that being personalized to an individual, because we all don't age in the same way and won't have the same disease profiles.
Thank you very much. My name is Mariam Hamid Matar. I am Emirati, MD, PhD, with a special interest in regenerative medicine. So when we talk about longevity, in my opinion, it's much better to go with regenerative health. So we can, I think we are in the present, and if we talk about the future, it's simply focusing on those young individuals who are between the age of 6 months and 6 years. There we start the real evidence base of longevity, in my opinion.
Thank you very much. Nicole Sorotin, Department Chair of Preventive Medicine at Cleveland Clinic, Abu Dhabi. Healthy longevity, to me, is very much aligned with how do we understand the human body with all of the technology that exists now. So how can we pull all of the information into a picture that both humans understand, meaning the human who we're testing and the human who's charged with their care, and then taking all of that information, putting it on a map, helping people say, this is where you are and this is where we want you to be, and then taking all of the data that exists with interventions and being able to help guide them on a path that will improve their health span, prevent and reverse disease, and help them live a long, thriving life.
Thanks so much for having me again. So I think for me, the future is really to bring healthy longevity medicine for all, at all ages and everywhere. So it means better data for different, again, ethnicities and geographical locations, but also for different ranges of lifespan, and bringing healthy longevity medicine solutions, even at a lower level, to the public. So again, public clinics, governmental clinics, especially university clinics, and make it more accessible. That's the future.
Thanks. So I think one of the exciting things at the moment is this confluence of data and data tools like AI with the mindset of optimizing healthy lifespan. And I think those things coming together being possible in ways that weren't in the past, like to learn from the bigger data sets in ways that also we weren't thinking about even 5 years ago.
Amazing. Thank you all. So my first question is actually going to go to Dr. Sorotin. As a physician myself who made a decision who was frustrated with the way that traditional medicine typically focuses on disease care instead of healthcare. How do we find that balance? As a physician, how do you find that balance between this traditional medicine that we know exists and actually these more modern or more exciting things that get a lot of social media attention and there's a lot of energy on? How do we find that balance while still protecting our patients?
Thank you. That's a great question. One of the things I think our goal is, and actually Professor Eva mentioned this, is that we have this great responsibility. We are charged with taking care of other humans. And with that responsibility comes the importance of us being able to be the filter of information for people. Yes, let's get information out there, but also we need to put it in a context that is, of course, our first and primary goal in medicine, which is do no harm. And so I strongly am very open with my patients, and I think my patients appreciate that. They can bring any idea, any intervention, any supplement, any concept to me, and we can talk about it. We can talk through the evidence. We can weigh pros and cons for their specific case. And I think the other piece that's important is that we have to bring traditional medicine up with us. And one of the goals that we were able to accomplish at Cleveland Clinic Abu Dhabi is to implement a lifestyle intervention program for all of our oncology patients. So every patient with cancer who comes through our hospital can access a physician who has an interest in and expertise in the lifestyle interventions that can help them both improve their cancer treatment outcomes and then also help prevent further diseases after their cancer treatment. So really getting at the root of that intersection. We need to be able to help bring in traditional medicine. We need to be able to be open with our patients about things that they're interested in or that they feel might help them with their health. And then be able to honestly look at where we are with the evidence in the same way we would with medications or surgical interventions.
Amazing. Thank you so much for that answer. To follow on with that trend, I think one question I also have is if we are attempting to find this balance, one thing we also have to think about is how we educate the future generations of doctors on this. Now, I know, Professor Ava, you have done the longevity education course, which I've done myself, and which is incredible, by the way, so definitely recommend. But it would be great to hear from yourself what other tools you think we might need to help with that education and making sure the next generation of doctors are also pursuing that.
Great. Thanks so much for raising this topic because I think the gap closers will be the physicians and healthcare professionals. I include here also nurses and therapists, medical staff. But physicians ultimately have the greatest accountability in terms of prescribing and diagnostic and so on. So my dream and work partially right now is to bring this curriculum and of course modified curricula to the med schools to first educate the new generation of physicians. So when they leave the med school, they already have the vocabulary of longevity medicine, they have the knowledge, they have the basics, they can go and know which paper to read how and to discern between fake and real. And secondly, also to bring this training and education to residents and seniors, because it's very important to educate us at all of the levels, especially the seniors, so they can educate better in the practice, because still the differential thinking and the knowledge of the sick care is very important also in order to properly practice longevity medicine, in my humble opinion. And last but not least, I think it's very important to educate physicians who are not in clinical practice, scientists, physicians in startups, physicians in public health and governance that maybe are not practicing actively, but will need this understanding in order to help us to facilitate all of the things we will need to practice better.
Yeah, I 100% agree, especially with, we've had a few conversations today about bringing innovation into longevity, but the importance of having the scientist, the doctor, right? There are so many different stakeholders in bringing longevity to the forefront. So my next question is for you, Ms. Professor Groba, which is actually when we think about doctors, physicians, healthcare providers, generally speaking, how do we involve them in that stage of drug discovery, drug development that you spoke about?
So actually, going back to the clock a little bit, this is done together with a geriatrician in Singapore who is currently doing his PhD as part of his future MD PhD in the lab, and he spends 3 days a week in the lab. And so one thing I think is really fun is I recently been involved with a lot of interactions with physicians who want to do the data science thing. I know that's not exactly what you asked, but it's kind of fun. The thing I get asked the most is like talking about R and programming languages for machine learning and statistics and stuff like that. And there seems to be a huge interest in learning these tools and acquiring these skills. And I think learning the languages across, nobody says they have to do the modeling themselves, but it's super useful for me to learn how they think, and it's very useful, I think, for them to see how the data analysis pipelines look like. So I think it's a really exciting time to sort of breach these silos and to say, well, yes, knowing this is useful for you, and vice versa, for me to go, okay, this is a really cool idea, but this is not worms. I can't just try this in people. It doesn't make any sense in talking to the physician. So I actually really enjoy this interaction.
Amazing. I do think, one day we'll have that person who is both a physician, does machine learning algorithms, and speaks every language across every border. Eventually, we hope so. My next question is about cultural divides. And I say this because I think that longevity is this really exciting field, and it's growing, and it's very interesting. However, what we know is that just the way that medicine is different across different cultural borders, I think longevity is going to face the same thing. So when we think about the things that we see on social media versus what is actually happening in clinic, there's a big difference, right? And what we accept within clinics and what actually happens out there in the wider world. So Dr. Matar, I want to ask you, as someone who has great insight into the healthcare system in the UAE, what do you think are the key challenges that we might face in growing longevity, especially in this kind of environment, in this cultural environment?
Again, my opinion, it's based on my personal experience, humble experience. I started talking about longevity long back in 2011 when I came back from Planet Japan. And I never knew that my community was not ready because, unfortunately, as you know, sometimes people have their own explanation about some values in Islam. So when I started promoting that I will elongate people's biological age, some members of my community, they were not able to differentiate between biological age and chronological age. So they thought I am coming with something against Islamic value and laws, where that the destiny is only with Allah subhanahu wa ta'ala. God is the one who will set your destiny. So it was not easy. So what I had to do, I had to educate myself. At that time, nobody was there to teach us to have a proper setting, proper guidelines. So I was a community physician, and I was lucky enough to be the first woman as Undersecretary of Public Health and Primary Health Care in my lovely young country. And at that time, I had a very good insight about the impact of legislation, impact of law. And I came to know that that is the shortest, fastest track for any new implementation in medicine. So I had to change the whole game. I started working in a very low profile, not touching anything related to age, not to talk about it loudly, and try to educate myself on physician level, then on some decision maker who's educated back in Oxford, Harvard. So we had to get that in mind. And at the same time, I came up with my own approach. Again, I had to come up with some new. So I made sure to sit one-to-one with 12 tribe leaders. In United Arab Emirates, we are 7 emirates. We have tribes, different tribes. And these tribes, they have a leader. And usually the whole tribes will listen to the leader. If they saw you close to the tribe leader, they see the tribe leader inviting you for his majlis, listening to you, applying some of those take and advice which you give to them. People start to accept me. They start inviting me in. So if I was not from this part, I wouldn't understand. And people come up with a lovely knowledge, but the community sometimes is not ready. And building on that question itself, I have my own opinion about what is going on in UAE when we talk about longevity. In my opinion, unfortunately, the whole mission of longevity, it's driven by commercial companies. It's driven by a company who's here to sell their product, to sell their test. So in the end of the day, unfortunately, the whole community driven behind the money. While in my opinion, and that's what I'm working on, to have things more constructive, we need to have academia in a place. So academia should involve early enough. The same way we were lucky enough to have New York University in United Arab Emirates. They are the one who came up with this cohort study for healthy living. So in my opinion, to have things in balance, we should open the door for newcomer companies, all of them. But in the same time, we have to make balance with academia having the same wealth by authority, by fund, and even the candidate who should be involved. So these things should be very well understood. And final elaboration on that itself, when I started back in 2011, nobody was there to guide me about NAD, resveratrol, stem cell, exosome. You can imagine I invested $200,000 on myself to go and get some courses in a sport medicine institute, in microbiome institute everywhere, to go back to Japan, to China, try to find some more information from those people who are purely academia, researcher. And then I came up with my own program, which I applied myself, I applied on my family. So I have my own opinion. I might be wrong, but for example, I will never, ever recommend probiotic. Never, ever. It's simply you are getting a new material in your body, while what we need to do, we need to work on nourishing the existing microbiome. And at the same time, right now, if you see in United Arab Emirates, my other nickname, Doctor of Sleep. So wherever I go, I hardly attend any event after 8 o'clock. My mother, she said, thanks God you attended your own wedding. So that's some of the element which is very crucial to us here. And the other point which I would like to highlight, and I'm trying to promote it on different level globally, to differentiate between sex, for example, if this supplement or this lifestyle is applicable for male or female, because in my opinion, whatever supplement, whatever medication you are taking for longevity, it should be stopped during your period, during those 5 days, because still we don't have enough study to differentiate the impact of this medicine on those female. The other point which I came up also with my humble observation, we have to bear in mind ethnicities. And with COVID, we came to know a profound effect of ethnicity on the way we respond to any biological changes. For example, in my opinion, I will never, ever recommend metformin for somebody from my lovely country or Middle East. I have my own conservation on that. I didn't do any clinical trials, but I've seen in pharmacogenomic, which is a test, it's a must to be done for any client, even before consultation, even before, intervention. So with pharmacogenomic, with the humble, I have around 33 tests where they are all Middle Eastern, and all of them, when you do the pharmacogenomic test for metformin, it doesn't work with them. And the same is applicable on statin and the rest. We have a specific type of mutation which is existing in our ethnicity, where statin will have no receptors in our cell. So when you see somebody Emiratis having his cholesterol, let's say 300, 400, you will start with a statin. Unfortunately, you will be overloading his liver and impairing his liver enzyme while you are dropping his cholesterol 20 milligram only. While if you will increase fiber, especially psyllium husk, 28 milligram per day for only 3 weeks, it's like a magic. The cholesterol will drop slowly because in the end of the day, you fed those microbiome who will have this metabolite, will go to the liver, and they will they will start the whole process. And the final point, which I believe also, apart from sex and ethnicity, is the weather. Nobody talks about the weather. In my opinion, you shouldn't use NMN in summer in United Arab Emirates where the temperature is above 40. You shouldn't. There will be a different reaction in your body, on your autoimmunes. So in my opinion, these do matters, and we need to reconsider it. Unfortunately, we don't have any medical guidelines which guidelines us as a physician that we need to stop these during the period, or to consider our ethnicity, or even to consider the weather. We come to United Arab Emirates promoting our product, take this, take that. And finally, last week I was in unhealthy discussion, but I had to go in it. I tried to be low profile, But sometimes, doctor, I can't, you know. When people starting promoting, let's say, collagen, everybody promoting collagen. Excuse me. You have to know if this person is living next to the sea, go for marine collagen. But if he's work as a Bedouin, working in the summer, going in the desert, spending all his week there, it's much better to start with animal-driven collagen. These small things really matters a lot. And I had to learn it by experience. I didn't find any guidelines. I had to trace for it. And I was really so grateful to have a great support from my dear Dr. Villine. Without her, I would be more lost. So she's one of my best friends as a sister, as a physician, and she's my guidance for that. Thank you very much. I hope I answered your question.
You definitely did, and much more, so thank you. Yeah, and, you know, great educator, but I think actually the points that you made are really, really profound, because actually that concept of, you know, this is why precision medicine needs to exist, because actually there are differences both ethnically across countries, and actually being able to recognize that and not just assume that there is a one-size-fits-all approach, which we know doesn't work, is incredibly important. Now, finally, Nina, I've got a question for you. So, Nicolina, as a startup founder that is working in this very innovative, space, what are the things that you think are important to help cultivate and grow the activity that you are doing as a startup founder? What things can organizations like Hub 71 do to support founders like yourself?
So I think we're a particularly different company because we span out of a research lab that's been around for 16 years now. And we never thought that this would be a commercial product. And we are now in some elite university. So it's kind of like either you're going to bring it to the market yourself or it's never going to see daylight. So, and it's a family affair in a way. So I think that's quite unusual. And it comes with a lot of hurdles, which are also unusual, where you don't really have the classical startup path. So we didn't really need to go for, you know, we didn't really need to create research from scratch. We had a lot to build on, which meant that we didn't really need commercial funding at the beginning. But then because we didn't get commercial funding, we didn't get a lot of attention either. So we realized actually we need a little bit of both. And then also half of our team are scientists who are by default non-commercial. And they are currently part of our product team, part of our sales team, part of our marketing team. These are all people who had to transition from their roles into a hybrid role to make something commercial. So I think the support we need is, of course, more research. As you go into every region, you need to personalize something to the region. And that's something we like to start with. So in this region as well, why we went into Hub 71 is all of the connections they have with corporates. Many of them hospital groups and research groups that we can collaborate with and through time, you know, create something very specific to the region. And actually our focus here is not so much the aging clock, because our market for that is the US. Our focus here is diabetes and research in this area and creating something very specific for that. So that's unique for it here. And I think other for support, well, depends on the company, but you know, we don't really have a big marketing budget. We don't really have a big commercial team. So a lot of time, and we're working with a very new technology. So a lot of time we're educating. So I think any opportunities for us to educate physicians, different audiences, we're always grateful for that. So, and that's why we love the Hub 71 platform. They're very good at that.
Amazing, thank you. I'm 10 minutes over what I was supposed to do, but I do want to give people an opportunity to ask questions. So I open to the floor. Any questions at all? Max is looking at me being like, get off this mic right now. I will come over here.
Thank you all for the wonderful panelists. It's my pleasure to attend for today. My name is Dr. Manna Mahmoud. I am an MD physician, and I'm a physician practicing in Abu Dhabi. Also, I did my master's from Arizona State University about science of healthcare delivery with Mayo Clinic. And I'm very interested about all the topics you have discussed. I have two questions, one directed to Dr. Mariam Matar and the other for the other panelists as well. Dr. Mariam Al-Matar, yes, I face the same with you, the same problem, because everybody's coming for me like they are taking prescription without, they are taking some vitamins and some collagen, and without asking their physician. And like for me, like I have to ask them, bring the product. I was searched by myself. So we found really, as a physician and practicing physician, a gap, a challenge, because we don't have a guidelines for that. We don't have a community that provide the translation and research about what you are talking about. And for me, I'm also like networking and attending like a pharmaceutical companies, all the products new to the market. But as you have said, like we have a different ethnicity. We have to study that. We have to know this drug, it will be effective to our population or not. So for me as a physician, it's okay. They're gonna convince me, but it will be affecting for my patients or not. So what do you advise to have such a community we can build and they can translate or create guidelines for the practicing physicians to help and protect our patients? So this is number one. Shall I ask the question, the second? Yes, sure. Thank you.
Thank you very much. I don't think I'm able to advise you how we have to do it. All what I can advise you, you have to join Dr. Eveline, come on board with us in this platform, because we share ideas, we share experience, and we are trying to come up with the guidelines. And unfortunately, in my opinion, majority of the physicians, they are outdated. We are waiting for the pharma company to come and teach us what is the medication for whom and how we can prescribe it. I think we as a physician, we need to go back to the medical college, but find a good medical college, try to educate ourselves and to be updated. Otherwise, we will be soon replaced by artificial intelligence.
Okay, thank you so much for your wonderful question. Connecting to your question to the other panelists, about education, I see that we are outdated. And for me, like I'm very interested in education and bridging the gap, because I believe that as the future physicians or leaders physicians who are combining MDs with all the advances in medical education. So I'm very interested about, I don't believe that we have to go back to the medical school, but as you have mentioned, that we can create centers, we can create excellent centers for education, as you have mentioned, Professor Evely and Dr. Nicole from Cleveland. We can provide like multiple excellent centers where we can provide education, as you have mentioned. We have across different people, because for me as a physician, like I have all my colleagues from the same masters, we are facing the gap. We are very ambitious and we want to create the change and bridge the gap, but we are not able to bridge the gap between the translational research and the advances in medicine. So we are MDs, we are dentists, we are pharmacists, but we need the collaboration between the seniors and how to educate. We are ready to educate the MDs, the students, the professors, the senior. So my question to all of you, and thank you so much for the opportunity.
Thank you for that important question. I'm very happy to be able to be a part of a new organization where we are focused on this issue. And so we will have the Institute for Healthier Living Abu Dhabi will be really, I hope, a force to be able to bring in a lot of the educational tools that have been developed, and also work with our local partners to be able to make this specific for the UAE, for Abu Dhabi, for the Gulf, for the Arab world. And I believe that this will help alleviate some of those challenges, because we all feel it. We all need some structure. We need the Healthy Longevity Medical Society. We need educational tools. We need to upscale, and we need to spread that throughout the health system, because if there's 3 physicians in one corner doing this, we're not getting in, we're not doing our job, right? So we need to be able to make this accessible and widespread.
Yes, sure.
Sorry. And in my opinion also, it is valid for us as a physician, try to understand more things in the lab, especially genetics, epigenetics, because I believe these are basic. And what made me different than any other physician, I'm not better than any other physician, but I had to go back to the clinic, study molecular biology to understand the genetics, the epigenetics. That would help me to build a bridge. But that's really, it should be an initiative from us to have it, and I think we will have a great opportunity. Everybody should be enrolled. And on the other hand, for you being practicing in United Arab Emirates, I believe it's very important from now for you to start your own reference data about your client. So have a small questionnaire or a small consent letter, if they can sign on it, that you can use their parameters, not their biological materials, not blood. So, and try to ally yourself to one of the academia around. This would help me. So go and knock the door on York University, Khalifa University. Tell them I have this project and I have this research on board. Believe me, you cannot imagine. They will welcome you in a way where they have at least 5 students who's doing their master or their bachelor, and they will be enrolling and they will do all the work for you. But we need to do that. And why I'm telling you that? Because this approach will be very effective and it will work like nowhere. I tried it, it works very well. Based on my local experience, I think it will be, inshallah, a good approach for you as well.
Thank you. Okay, we have time for one more question, but can I ask that we be as quick as possible?
Yeah, hi, Dr. Sushma here. Thank you for your honest feedback on no statin, no probiotics, and no collagen. With this kind of epigenetics of UAE population, let me add that as well. Professor Evelyn, I'd like to ask you something. Post-gut microbiome testing, how do you go ahead and interpret the results and treat it as per personalized medical care for a particular patient? How do you go about to increase the longevity post GI mapping?
So thanks so much for the question. I think, as I mentioned, microbiome is one of the most powerful tools that we have in longevity medicine. Should probably also be a part of the hallmarks. Once it's mapped, and once we have also the distribution, right? So we look at not only the mapping, so the strains, we look at the frequencies, we look at the timing it was taken from, at whom, and so on, and also looking at, let's say, the mosaic. So let's say we have a good distribution of everything, but is that distribution, even though it's good for the general population that it was mapped on, good for that specific person? And then, as Dr. Matar mentioned, number one, always, one can say nutrition. I try to use the word metabolomics, because people think, okay, I'm putting a patient on a diet, which it is not. We need to increase the metabolism. We need to change and reshift a person's, let's say, the way the person is digesting things, and then, of course, some of the supplements from prebiotic, so precursors mostly, to reshift the strains. There are also some supplements that help us also to reduce some of the strains that we might want to reduce, right? Including, and for microbiome, we usually think about bacteria. We have to remember that we also will find fungus. We also will find protozoas. They are very impactful on the gut health. And then the inflammation. So wherever I can, I also do the DNA liquid biopsy from the stool of the patients, not only for the occult blood, but also occult iron and other elements that we can find in the stool that will help us to, make a whole picture of the microbiome. So very complex, but again, something that can be learned and seen, and it's we have increasing amount of tools to implement already.
I will build on your comment just now. So if we go to microbiome, again, on my humble experience in the local community, what really worked very well with those microbiome tests, which was really nasty with overgrowth of fungal, it's going back with the native food. And I tried that on my own client. very closely. So one of the things which improve the quality and the quantity of the microbiome and increase their metabolites, for which, for example, precursor for serotonin, for dopamine, it goes back to maintain local food, because you cannot imagine, although we think that the food, the vegetable we eat very clean, it goes along with some microbiome with it in our body. Number two, we need to respect Mother Nature. So it's unhealthy for you to have any type of food 3 hours before your bedtime. You can imagine these microbiome throughout the day, they are struggling to digest and metabolize what you ate. So only at night they have time to have babies every 20 minutes. That's the only time where they will be able to excrete those metabolites, which is very essential for your brain neurotransmitter. And at the same time, we have to bear in mind that these microbiota, because microbiome, it's the environment in which the microbiota live in. And microbiota, they are bacteria, virus, and fungal. So when we talk about these microbiota and the way we sleep, sleep plays a huge role in improving your microbiota, and try to stay to seasonal fruit as much as possible, and try to stick to a local water. This might be theoretical, but there is good number of studies where they had enough budget to study such subject, and it really helps a lot to respect nature. Last meal should be 3 hours before bedtime, and to make sure to have a local food and increase fiber intake. Minimum amount of fiber intake for any individuals above age of 16 should be 28 grams of fiber. And regardless type of food you will take and vegetables, you won't be able. So you need to have supplement. And the best one is psyllium husk fiber, which is available, affordable. You can buy 500 grams of psyllium husk fiber with only 10 dirham, and it will be enough for a whole month. So sometimes there is minor changes which will have a dramatic impact on reversing and reprogramming your biological clock.
Great. Thank you very much. So I'm definitely going to go and buy some cereal husk fiber, I think. I want to say thank you very much to all of our panel members. You guys were amazing, and thank you for the really spirited discussion. And thank you to the audience for some really great questions. Round of applause.